Live from Denver 7, 10 minutes of nonstop news starts now.
Some disturbing numbers this morning to tell you about. Every 9 minutes, someone dies from colorectal cancer.
9 minutes. It's the second leading cause of death from cancer for men and women combined, and this is National Colorectal Cancer Month. So we've asked Dr. Anthony Madrid, he's a board-certified gastroenterologist, to talk about the disease and how we should all be out there getting screened. So first of all, how do we prevent colorectal cancer? What do we do?
Well, screening is the most important thing. And what we recommend is if there's no family history of colon cancer and you're at the age of 50, you should get a colonoscopy for your screening. Now, if there is a family history of colon cancer in your family, well then you should probably get screened earlier than the age of 50 and probably at the age of 40, if not earlier, depending on when the patient or when your family member was diagnosed with colon cancer.
Okay.
There is a website that we have, RMGA, in which you can get more information about the screening and what that entails.
Okay, so are there signs of colon cancer that people would notice or they should be on the lookout for?
Well, some of the signs that someone may have is if they're iron deficient, if they're anemic, that means if their blood level is low, if they have sudden weight loss and they're not trying to lose weight. And then you're also looking at maybe blood in your stool. These are some of the telltale signs of when you should get a colonoscopy. Most importantly, though, if there's no signs, we're recommending screening at the age of 50. This is the great way to prevent colon cancer.
So, and I need to have this done. What happens during a colonoscopy exactly?
Well, it's actually, it's much easier than what you think. Your imagination's going to play some, some funky games on you.
Yes, it will.
But let me tell you, it's only a 20-minute procedure.
Good.
You'll spend more time worrying about the procedure. Now, we'll talk about the prep in a moment.
Okay.
But the procedure itself is very simple. For instance, if you came into our facility, we would give you some sedation, something called propofol. It's a wonderful medicine. You're going to a very nice sleep. You won't remember a thing. You won't feel a thing.
Wonderful.
We'll be passing a scope from below. We will evaluate the entire colon. We start at the rectum. The colon itself is about 4 feet in length. If we find any polyps, we'll be taking those out. Polyps are like little skin tags that grow within the colon. They can grow bigger. Some of these will turn into cancer. So the goal here is to find these polyps and remove them.
Okay.
Hence, colon cancer prevention. Once these polyps are removed, they will not grow into colon cancer. They're no longer there.
Okay.
We have just saved you from getting colon cancer.
And you
Nice.
talk about prep. I've heard preparation sometimes can be the most challenging part for this.
Exactly. In fact, what I tell my patients, you'll spend more time thinking about the colonoscopy. The prep is probably the one thing you need to worry about, and we've actually, after doing many different preps, have come to a prep that we like to give our patients because it's quite gentle. And here I have some of the props that we're going to be using.
Okay.
Now, you'll take 2 tablets of Ducalax.
All right.
You'll also take some Miralax, and you mix it in a 64-ounce Gatorade. That's your prep.
Okay.
Try to drink 8 ounces every 15 minutes. You got 2 to 4 hours to finish this. And that's your prep, and that's all it takes.
Pretty simple stuff.
Pretty simple stuff. And
Don't want to get
it's
too far from
Gatorade,
the
you're going to
house,
like
but
it.
yeah, it's pretty simple stuff.
Yeah, get a good magazine. You don't want to get too far away from the house.
There you go. But very, very good, easier ways to prevent colon cancer.
Correct.
Quickly, we're about to run out of time. You've got a special kind of a fun event coming up that raises awareness. Tell us
Yes,
about
it's
it.
called the Undy 5000. There's a website, undy5000.org. These are some boxer briefs.
Okay.
Most of the time when you do a 5K, you're going to get a T-shirt. Well, what we're giving out is a boxer brief. This is a great way to just get involved with helping prevent colon cancer and educating people out there about
Sure.
colonoscopies and why they're done.
Very
Dr.
good.
Madrid, thank you so
Thank
much
you.
for being here today.
Thank you
feel
very much
better?
for having me.
Absolutely. Ready to go.
Okay. All right. We have more information that you can, how you can contact Dr. Madrid and also more on the event. Go to our website, thedenverchannel.com, and click on the big red TV button.
Thanks for taking time.
Thank you very much.
Appreciate you coming in.